Hello and welcome to Rafa Health, where we share natural remedies to heal and repair the body, promoting a healthier, happier you. In today's session, we're delving deep into a matter of utmost significance, one that holds the potential to be a lifesaver, identifying the signs of an ailing or sick heart. Given that our hearts are integral to our well-being, it is of the highest importance to be able to discern these cues and respond promptly if they manifest in you or someone within your circle. Here are 7 signs of a sick heart. The first sign of a sick heart is chest discomfort. Now don't imagine this as some complex puzzle. It's like receiving a message from your body in the form of pressure, tightness, or even pain in your chest. And here's the twist. This discomfort isn't always a sharp pang. It could be more like a gradual squeeze or a feeling of fullness, as if your heart is trying to tell you something. If these sensations decide to stick around for more than just a passing moment, lingering for several minutes on your body's stage, that's the cue to take action. Don't hesitate. Seek out medical assistance pronto. It's better to have a professional check things out and ensure your heart's rhythm is back in tune. The second sign of a sick heart is shortness of breath. Imagine this scenario. You're going about your day, maybe climbing a short flight of stairs or engaging in light tasks, and suddenly you find yourself huffing and puffing as if you've just run a marathon. It's like your body's own alarm system going off, telling you that something might not be quite right with your heart's performance. Here's the catch. This isn't a sign to be brushed aside or waved away as mere fatigue. Your body has a unique way of communicating, and when it comes to shortness of breath, it could be hinting that your heart isn't efficiently pumping blood. Now, it's tempting to attribute this sensation to a lack of exercise or being out of shape, but it's wiser to consider it as a prompt for action. Instead of assuming, it's a prudent move to consult a medical professional. The third sign of a sick heart is fatigue. Have you experienced an unusual, lingering tiredness that persists even after you've enjoyed a full and restful night's sleep? This sensation can be likened to a soft whisper from your body, gently indicating that there might be something amiss with your heart's harmony. Imagine you wake up in the morning after what should have been a rejuvenating slumber, yet you find yourself weighed down by an unshakable weariness. Throughout the day, it's like your energy reserve is rapidly depleting, and staying awake becomes a struggle. Instead of considering this fatigue as mere sleepiness, regard it as a possible flag raised by your body's inner compass. Your heart might be sending out a subtle distress signal that shouldn't be ignored or brushed off. The fourth sign of a sick heart is an irregular heartbeat. As we continue our exploration, let's focus on a delicate aspect of heart health, its rhythm. Take a moment to listen to the cadence of your heart. Do you ever notice instances of frequent palpitations, those fleeting moments when it feels like your heart skips a beat, or even episodes of your heart racing as if it's chasing after time itself? These could be your body's whispers, offering insights into the intricate world of irregular heartbeats, medically known as arrhythmias. Your heart, which usually maintains a consistent rhythm, may sometimes deviate from that pattern. This could result in moments where the beat feels uneven or irregular. While occasional changes in rhythm are quite common and usually not a cause for concern, if you notice these irregular patterns persisting, it might indicate an underlying problem that requires further investigation and attention. Before you let anxiety take the lead, understand that not every hiccup in your heart's rhythm is a cause for immediate alarm. However, it's a wise move to remain vigilant and proactive. Those persistent irregularities might be your body's way of sending you a coded message. Consult a medical expert. The fifth sign of a sick heart is swelling. Let's delve into a significant indicator that shouldn't be overlooked: swelling, particularly in the areas of the legs, ankles, and feet. This phenomenon can sometimes serve as a potential indication of an underlying heart issue. Here's what happens. When the heart's ability to effectively pump blood is compromised, it can lead to difficulties in regulating fluid balance. This can result in an accumulation of fluid in the lower extremities, leading to swelling. It's as if your body is giving you a tangible sign that something might need attention. Now, it's important to clarify that not all instances of swelling are directly linked to heart problems. Factors like prolonged sitting, standing, or certain medications can also contribute to swelling. However, if you observe sudden or pronounced swelling in your legs, ankles, or feet, especially if it's accompanied by other symptoms like shortness of breath or fatigue, it's crucial to take it seriously. The sixth sign of a sick heart is dizziness and fainting. Let's delve into another crucial aspect, dizziness and fainting, which can potentially indicate an underlying heart condition. When your heart doesn't manage to pump an adequate amount of blood to your brain, you might experience sensations of dizziness or lightheadedness. In some cases, this can escalate to the point of fainting. Here's what's happening. The reduced blood flow to your brain can momentarily disrupt its function, leading to these unsettling feelings. It's like a temporary imbalance that your body is grappling with, which warrants attention. Now, while occasional dizziness might stem from various factors, like dehydration or low blood sugar, persistent or increasing occurrences should definitely raise concern. These episodes could be a signal that your heart isn't functioning as it should, and it's important not to disregard them. If you're encountering bouts of dizziness or experiencing fainting spells, especially if they are becoming more frequent or severe, it's paramount to consult a healthcare professional. By doing so, you can undergo a comprehensive evaluation to determine the underlying cause, which might involve assessing your heart's health through tests and examinations. Remember, your body provides valuable cues, and acknowledging them can contribute to maintaining your overall well-being. The seventh sign of a sick heart is a persistent cough. A lingering cough that seems to persist over time, particularly if it accompanies the production of white or pink mucus, can be a telltale sign of a sick heart. Here's the mechanism behind it. Your heart's reduced efficiency in pumping blood can lead to a backup of fluid in your lungs. This accumulation can trigger a cough that may manifest with the presence of frothy or tinted mucus. It's as if your body is signaling that something is amiss within your cardiovascular system. Now, while a cough can often be linked to common colds or respiratory irritations, a consistent and unyielding cough, especially with the added dimension of mucus that's not its usual color, should pique your attention. When this cough becomes a companion to other symptoms, it's a prudent step to consider the potential connection to your heart health. Bear in mind, the well-being of your heart should never be treated lightly. Whether it's you or someone close to you, if any of these warning signs arise, chest discomfort, shortness of breath, fatigue, irregular heartbeat, swelling or dizziness, it's imperative not to procrastinate seeking medical assistance. Acting swiftly can make all the difference in preventing potential heart-related complications. If you found the information in this video valuable, don't hesitate to show your appreciation by giving it a thumbs up and passing it along to those dear to you. Prioritize your heart's health, and we look forward to reconnecting with you in our next video. It's important to note that the materials and information presented on the Rafa Health channel are intended for general educational purposes. They are not intended to replace professional medical advice or treatment. If you have any health issues or medical concerns, we strongly advise you to consult a qualified medical doctor for proper diagnosis and treatment.